Hello, I'm Ashley Leffelholtz, the Clinical Health Director for Honoro RX Pharmacies. July is UV Safety Month, so I thought it might be a good time to review some of the basics of sun safety. So you can always ask your pharmacist. This is an overview of the basics of sun safety and how to protect yourself from harmful UV rays. However, if you ever have specific questions about certain medications or anything discussed here, be sure to call your pharmacist. So I'll go over the basics of why you need protection from the sun, what is SPF and how do I choose a sunscreen, and then some medications that cause or increase sun sensitivity. So to start off, why do I need sun protection? So everyone needs a little exposure to the sun. Our body needs the UV rays to produce vitamin D. However, unprotected exposure to the sun's UV rays damages your skin and your eyes and then can lead to cancer. So what happens is when your skin's exposed to the UV rays, it increases the production of melanin, which is what causes tanning. However, overexposure, so when you get too much sun, it leads to sunburn. There are different types of UV rays. So there's UVA that causes the aging, premature aging, wrinkles, loss of elasticity. Can still cause cancer, but more so the UVBs are more likely to cause cancer if we're looking at the two of them. But by properly wearing sunscreen, you can reduce your risk of damage. So some statistics, 9,500 people are diagnosed with skin cancer every day in the US. 2 people die every hour. So 1 in 5 Americans will develop skin cancer by the age of 70. 200,340 cases of melanoma will be diagnosed in 2024, which is an estimate from skincancer.org. And 86% was the number of cases of melanomas that were attributed to UV radiation from the sun. That was from a study in the UK. Of the 200,000 cases I mentioned that will be diagnosed in the US, it's estimated that about 99,700 cases will be non-invasive, which means it's confined to the epidermis, which is that top layer of skin. And the other 100,640 cases will be invasive, so penetrating down into the epidermis, which is that second layer, penetrating the epidermis to get down into the dermis, which is the second layer. Of the invasive cases, 59,000 will be men and an estimated 41,000 will be women. So in the past decade, from 2014 to 2024, the number of new invasive melanoma cases increased annually by 32%. And the vast majorities of melanomas, like I said, are caused by the sun. Having 5 or more sunburns doubles your risk for melanoma. And when detected early, the 5-year survival rate of these cancers is 99%. So it's really good to be on top of that and have regular checks by a dermatologist or your primary physician. So moving on to SPF. SPF stands for sun protection factor. So it's a common misconception. A lot of times I hear that SPF is related to the time. So people think the higher the number, the longer they can be in the sun. But unfortunately, that's not true. So sun protection factor measures how much UV radiation it takes to cause a sunburn on protected skin versus the same amount of UV radiation on non-sunscreen skin. So as the number of the SPF increases, the rate of sun protection increases. So factors, that's the general overview. There are some factors that also alter the exposure amounts, so the amount that a normal person is absorbing. So the time of day, so an hour at 9 a.m. has the same exposure as 15 minutes at 1 p.m. Your geographical location, your skin type, so patients that are pale versus patients that have really dark skin, the type of sunscreen applied, so mineral versus chemical, and then the activities performed while wearing sunscreen. So are you swimming? Are you sitting? Are you sweating a lot? There's a lot of different factors that can impact that. So what are some advice or some safety tips to stay safe in the sun? So I do always recommend choosing a sunscreen with SPF 30 or higher, and you need to reapply it often. You also need to make sure you're applying enough sunscreen. So a lot of times, especially when I see people using sprays, they do one quick spray, rub it in a little bit, and then off they go. So you really need to coat the entire area and rub it in really well to make sure you're getting that full protection. Another good piece of advice is to wear clothing to cover the areas of exposed skin. This can include wide brim hats, sunglasses, long sleeve shirts, pants. They make UV rash guard shirts, so things like that. So just covering up the skin is a great way to protect yourself. And then limit your time in the sun during the times of highest UV intensity. As a reminder, that's 10 a.m. to 2 p.m. So how do I choose a sunscreen? So there are a lot of different options. First and foremost, I want people to choose the one that they're most likely going to apply. If someone's not going to take the time to spend 5 minutes and apply a cream really, really well, they'll get some protection from that spray. It's a little quicker, but like I said, you still need to apply a fair amount. So um, its odor helps people, so find one that smells nice to you. Just something that you're going to put on. You do want to read the labels to make sure whatever you're selecting is broad spectrum. So broad spectrum means it protects against UVA and UVB. Most sunscreens out there are broad spectrum, but you really want to look for that to make sure it does cover both. Just a quick tip, if you are using the spray, you don't want to spray the sunscreen directly on your face. You spray it in your hand if you want, and then use that to apply to your face. Some of the, especially the mineral sunscreens, you don't want to inhale, so it's best to avoid that. And then reapply more frequently when you're in the water or sweating heavily because it does wash off. So if you look at your sunscreen that you're getting, usually it'll say water resistant and then have a time. It may last a little bit longer. We usually say sunscreen will last about 2 hours without being wet or sweating. If you're doing any of those activities, it doesn't last quite as long as it otherwise would. So you want to reapply every 80 minutes. So the sunscreen ingredients, um, like I said, they can be either a mineral or chemical. Mineral is the zinc oxide and the titanium dioxide. That sunscreen physically blocks the sun from being absorbed. So when you put it on, it sits at that top layer of your skin and blocks the sun rays from getting absorbed. So it's effective quickly. It's sometimes a little harder to rub in. It sometimes may have that white tint. And it does need to be applied a little more frequently, usually, especially if you're sweating or getting wet. If you think about it, if it's not getting absorbed into your skin as soon as it gets wet, it has a higher tendency to get washed off. Now, the chemicals, on the other hand, that's your avobenzone, your oxybenzone, your homosalate. The chemical sounds like chemical names when you're looking at it. So if it's not zinc or titanium dioxide, it's probably a chemical. Those sunscreens will absorb the UV rays. They get absorbed into your skin, so they sit down a little deeper. They absorb the UV rays, turn the rays into heat, and then they re-release them from your skin. So these sunscreens do take about 10 to 20 minutes to become effective. So just be aware of that. When you put a mineral sunscreen on, you're good to go a lot quicker. The chemicals do work just as well, but they do take a little longer. So you need to put them on before sun exposure. And then ingredients to avoid. There are studies going on. There's no current evidence sufficient to support the causal relationship between the elevated levels in your body and adverse health outcomes. But of note, they have found that oxybenzone and octinoxate were common sunscreen ingredients, and they've been banned due to their toxic effects on marine ecosystems. So they have found absorption in humans as well. But again, there's no link to adverse effects currently, so there's still studies that need to be done. And a lot of times when you're looking at these sunscreens, especially if you're going to the ocean or places with coral reefs and you want to keep that marine ecosystem healthy, there are reef safe markers on a lot of sunscreens. So Blue Lizard is one, there's a few others. They'll have that seal on them that just says reef safe. You can also look at the back. I marked the homosalate and the oxybenzone. I marked the oxybenzone. Homosalate is not studied yet. So the oxybenzone is the one that gets absorbed, and it's one you want to avoid. So let's talk about some medications and their increased sun sensitivity. So there's different kinds of reactions that can occur. They're divided. They're all called photosensitivity, but they're linked or divided up into two categories. So there's photoallergy and there's phototoxicity. So photoallergy is what happens when the skin's exposed to the sun after the certain medications are taken or applied. And this is an immune type, an immune mediated, it's a delayed type 4 hypersensitivity reaction. So the drug will photobind, sorry, the drug will photobind to the skin. Okay. Sorry, technical difficulties here. So the drug photobinds to the skin, and then upon its exposure to UVR, it forms a photoallergen. So you have to be initially sensitized to this reaction, but so the rash is not immediate. Usually then the rash happens once you're re-exposed to the light, and you get it's an eruption. It's seems similar to eczema, but it happens usually 1 to 3 days after the exposure. And then the rash can spread to parts of the body that were not exposed to the sun as well. So this one, it's just important to remember it's going to be delayed, and it can take a few days to happen. The phototoxicity, that one happens when the sun is exposed, or the skin's exposed to the sun after certain medications. The sun, in this case, absorbs the UV light and then releases it into the skin, causing cell death. So within a few days as well with this one, it's usually a little quicker than the photoallergies. It still does take a few hours to a few days. The symptoms will appear on the exposed areas of the body. Sometimes these kind of pop up and then they go back away. Sometimes these reactions can persist for years after the medication is stopped. So it's important to remember these reactions don't happen to everyone. Sometimes it will, sometimes it'll happen once and stop, and then sometimes the damage happens every time you take the medication. So it is more prone in patients who already have pre-existing skin conditions, such as eczema or autoimmune disorders, such as lupus. So those patients need to be particularly careful when in the sun, especially when taking these medications. So what are some examples? So the antibiotics, your quinolones, so the ciprofloxacin, levofloxacin, those types of medications, those cause a photoallergic reaction. Tetracycline and sulfonamides cause phototoxic. For your antifungals, griseofulvin, that one's not used as much anymore, but it can cause an allergic reaction. Fluconazole, ketoconazole, those can cause phototoxicity. Antihistamines, such as your Zyrtec, diphenhydramine, loratadine, which is the Claritin, those, and then as well as promethazine or cyproheptadine. Cholesterol lowering drugs, so your statins, atorvastatin, simvastatin, lovastatin. Diuretics, so this would include hydrochlorothiazide, other diuretics such as furosemide and triamterene. NSAIDs, so non-steroidal anti-inflammatories such as ibuprofen and naproxen. Oral contraceptives and estrogen, chlorpromazine, glipizide and glyburide, which are used for diabetes, retinoids, and alpha hydroxy acid. Those are usually found in cosmetics, and then ACE inhibitors as well. So your lisinopril, benazepril, those types of medications. So again, they don't happen in everyone. It's just something you want to be aware of. Use a lot of extra caution, and if you do have trouble with the sun sensitivity, let your physician know so they can kind of weigh it case by case and see if there's a different option that would be good for you. So here are my references. And please remember to ask your pharmacist if you have any questions at all. Thanks so much, and visit us at www.honororx.com. Thanks. Have a good day.